My name is Pete Hanlin. I work with Essilor of America, and I'll be moderating our discussion. I am very privileged to be joined by an amazing panel that is comprised of Dr. Millicent Knight, who is an optometrist and the Senior Vice President of Customer Development at Essilor of America. I'm also joined by Dr. Ryan Parker, also an optometrist, who is the Director of Professional Services at Essilor of America. I'm joined by Dr. Howard Loff, MD, who is an oculoplastic surgeon who owns Doctor's Optimal Formula. And I'm also joined by Brooke Carrasco, an optician who serves as the Manager of Customer Education at Essilor of America. So today our topic of discussion is going to be no glare lenses, but specifically we're going to talk about a little discussed aspect of no glare lenses. Everyone knows that they help your patients see better and look better. Also, however, no glare lenses can protect your patients against the harmful rays of ultraviolet light. So to kick off our discussion, I'm going to start with Dr. Parker, and the question I have for him are, can you describe no glare lenses and how are they typically presented to patients? Dr. Parker?
Thanks, Pete. Yeah, I go back to my days in private practice. I got to spend 14 amazing years in private practice. And here's the thing that I learned from that journey is our patients, our customers, judge us based on how well they see out of their glasses. And that's one of the reasons that I really wanted to use non-glare, because we know it gives patients a better visual experience. It reduces reflections, they look better, they're safer driving at night. And we spend a lot of time talking about clarity, cleanability, and durability. And all of us know that non-glare is an amazing product because I'm sure most of us that are taking part of this event have non-glare on our lenses. In fact, most of the customers or the ECPs that I go out and talk with, and when we do lectures about this, it's 100% in the room. But our consumers are at about 40%, so 4 out of 10. So there's some low-hanging fruit. And I think a lot of the times we don't tee up the conversation properly. We talk about all of those things and we miss something that Crizal does amazingly well, and that's protection. So not only great vision, but great protection. In fact, other non-glare lenses actually increase ultraviolet reflections off the back part of the lens by up to 50%. And Crizal has amazing technology in there that reduces those reflections down to 4%. So we can talk about all those other things, but we have to increase the value for our consumer. I really think that we do that by leading with the message of protection. And I know when I was in practice, that was a game changer for me because I wasn't doing much better than that 40%. But once we started talking about Crizal differently, more patients started purchasing this and had a better visual experience. Now, many of you may be going, okay, why are we talking about ultraviolet radiation on non-glare lenses? Because non-glare really is indoor glasses. And I would tee that up by saying, wait just a little bit here, because Dr. Loff may talk a little bit later about we do get a little ultraviolet radiation indoors, and we know it's a cumulative exposure over time. But what I like to talk about is how many of you been outside today without your sun protection on? I'm guilty of it. I walked out and checked the mail earlier and I had my everyday glasses on. And that's the thing that we have to think about. I know I saw many of my patients running around Southern Oklahoma without their sunglasses. And that's a great thing about Crizal. We put that on their everyday pair. It gives them amazing vision, but also does a great job of protecting them when they're exposed to ultraviolet radiation without their sunglasses on. So Pete, that's my 2 cents in a nutshell, a little bit about non-glare and how that conversation usually transpires from the exam chair.
Yeah, thank you, Dr. Parker. Yes, sadly enough, a lot of our patients only have one pair of prescription lenses. So it's great to think that we can offer them some protection on the pair of glasses they're probably wearing most of the day. Now, having heard about no glare lenses, let's talk a little bit about what exactly UV light is, where does it come from, and although I think most of us have an idea of why we should be concerned, maybe some specifics about how UV light interacts with the skin and with the eye. And for that discussion, I'm going to turn to Dr. Millicent Knight and Dr. Howard Loff. So, doctors?
It's interesting. I think back and thinking of reflecting on that question, I think back to my very first practice. And in that practice, this was a hospital-based optometry ophthalmology co-management practice. And my job there was to do all the pre-op care and all the post-operative care. And what that involved is not only taking care of the patient after surgery, but also making sure that they had the right refractive tools after they finished to make sure that they had the proper protection. It's so critical because when you talk about the source of that UV is primarily coming from the sun, but it's all around us, it's ubiquitous. And one of the things that we've noticed more recently, especially in this COVID era that we're in, is that we are using many more digital devices. We are indoors, we're in meetings all day, we're around, surrounded by lights, we're surrounded by UV and also harmful blue light. And so it's really critical to make sure that we have some always on protection to make sure that even if we step outside in the sun, and we do know that you do have to get a certain amount of sun, we do need that vitamin D. And then children, of course, need sun as it relates to myopia. There's just so many different reasons there, but you have to do it in moderation and you need to do it with the right protection in place. When I went on to buy a practice later on, I continued to have the concern about UV protection as it related to more mature patients, but I also think about it as it relates to children. And you talked about people in Oklahoma. Well, in Evanston, Illinois, where we only had summer for 3 months out of the year, people just went crazy in the summers and they were out playing all kinds of activities and the children were out all day long. So it was really critical to me to make sure that they had some type of UV protection. And when you talk to moms about it and you explain the value associated with it, I rarely had a mom say no. So those are the things that are really, really important. And then UV is associated with anti-aging, and part of my practice was involved in anti-aging regenerative medicine. And that is a multi-billion-dollar industry, by the way. I'm sure Dr. Loft can attest to that. But patients are concerned about the lid, the eye area, the adnexa around the eyes, wrinkling. People are concerned about that. And when you educate them and you provide a value associated with it, my experience has always been that patients are willing to pay for what they find value in. Now, the other reason outside of aesthetics is you want to make sure that you don't end up with skin cancer. And we've got a number of patients that would come in and I take a look under the slit lamp and you find lid lesions that end up being basal cell carcinomas, squamous cell carcinomas, some just benign. But you know, the thing is, those have to be checked out and those patients really need to make sure that they have some type of back surface protective device, which Crizal offers, to make sure that they're not getting that additional UV exposure and damaging that sensitive skin around the eye area because it's thinner than the rest of our skin. And so it's much, much more at risk. Right, Dr. Loft?
Hi, thanks for that kind intro, Dr. Knight and Pete. That is correct. The eyelid skin is one of the thinnest skin of the body and therefore the most susceptible to burning and skin cancers. Obviously, you'd mentioned the different types of exposure with UV exposure, with blue light exposure. And just want to preface this by saying I'm not affiliated with Essilor, so I can say this without any bias, but had I known in private practice about the Crizal lens with the UV protection, specifically as it relates to the posterior aspect of the lens, decreasing the internal reflection, then would cause increased UV exposure to the periocular region. That would certainly have been my lens of choice to recommend to patients, both patients that were wanting to get glasses for the first time and certainly patients that had previous history of skin cancer, family history, or risk. So it's a great lens, and I would certainly encourage Essilor, Crizal to go ahead and hopefully not only educate patients, but certainly educate eye doctors as well about the benefits, because there's a lot of physicians out there, dermatologists, plastic surgeons, as well as eye doctors that certainly don't know the benefits. So I want to applaud Essilor, bring this to everyone's attention. Again, in addition to having great benefits as it relates to optics, there are a lot of other benefits related to UV exposure, and blue light blocking benefits as well. And again, as an oculoplastic surgeon, we would see a lot of patients with skin cancers. The most common, about 90% of skin cancers around the eye are basal cell carcinoma. The remaining 10% are typically squamous cell, as well as melanoma and other types of skin cancers. And again, as Dr. Knight had mentioned, the eyelid skin is extremely thin, very susceptible to burning, which increases the risk of skin cancer. And the periocular region, eyelid region, is the most common occurring area of the body as it relates to skin cancers. About 5 to 10% of all skin cancer are in the eye region. So very important to have that type of protection to decrease the risk and incidence of skin cancers. The other comment to make, as well as not only skin cancer, is also damage to the eye, to the retina, and lens of the eye. And obviously, there's different types of UV rays. There's UVA, UVB, UVC. UVC, even though it's the most dangerous, fortunately, it's for all intents and purposes completely filtered out by the ozone layer. So that's something that is not very impactful. UVA and UVB are certainly more common, and UVA has longer wavelengths, so it penetrates the tissue deeper, affects the ocular tissue, again, the lens and the retina, as well as the most common culprit for aging changes and photoaging, wrinkling, and anti-aging or aesthetic type of issues around the eye. So the additional benefit of not only helping to protect the eye, but hopefully decreasing aging changes around the eye is certainly very impactful.
Yeah, I know in a former role at Essilor, I was directed our technical marketing function, and I would have a lot of opticians say, hey, I use polycarbonate or high index or some material that blocks ultraviolet light that strikes the front of the lens. But there's been numerous studies done that show that 30 to 50% of our UV exposure to the eye actually comes from reflections from the back of the lens. And as Dr. Parker mentioned earlier, many no glare coatings actually enhance the reflection off of the lens, the back surface. And of course, we usually put the sun to our backs whenever we're working outside. So we're kind of putting a collective dish that focuses ultraviolet light back on our retina, or our cornea, sorry about that. Of course, in the exam room, it's always crucially important to have these discussions about ultraviolet light and how we can protect our eyes, but we all know that many of the discussions with patients come at the dispensing table. And for that reason, I'm very happy to have Brooke Carrasco with us, who is an optician. And Brooke, could you walk us a little bit through how an optician might dispense or talk about no glare lenses when they're at the dispensing table after they've seen the doctor?
The answer to this question, I feel like, can be summed up in one word: teamwork. A whole lot of teamwork. So as you guys know, each and every staff member plays a key role in the entire journey of the patient's experience in the office. And so it's vital that each and every staff member, including the doctor, are on the same page, and the message is clear and it's cohesive. When they get to us in the optical, this makes our jobs so much easier, if that's the case. Patients entrust us with their eyes, and yes, but more notably, they share their trust with us. They come to us for help and guidance, and with that, we must educate them, not just at the dispensing table, but throughout the entire office experience. So during my time in practice, I was honored to work alongside an amazing optometrist that strongly believed that his practice was only as strong as his weakest staff member. He took the time and care with each one of us, as well as his patients, to ensure that education was always top priority. So the mindset was infectious, and each and every member of the team followed by his example. So we are in a unique business that presents our patients with both the opportunity to be a one-stop shop for all of their eye care needs. But the ugly truth is, if the patient is not satisfied with their visual experience or outcomes after picking up their glasses, they blame the doctor. But the solution is clear that cohesive messaging received from all team members throughout the office experience is vital. And ultimately that will end with a complete visual solution that improves their quality of life and most importantly, meet and exceed their expectations. So with that, we can all agree that finding the right words to describe visual ins and outs and capabilities and errors as well is very difficult as a patient. We as eye care professionals are armed with the right words and vocabulary to better express the miracle that is sight. But it's hard. It's very difficult to express what they're feeling. So in that conversation and ensuring that we are able to have a meaningful conversation and communication with our patients, it's just so vital as opticians that we have the right tools to aid us in that conversation. Looking back when I was having those conversations about what the heck anti-reflective is, I can say without a doubt, I leaned heavily on those demo tools. The demo tools that I appreciated the most, one of which was a pair of glasses that we had made. One lens had no anti-reflective and the other one had anti-reflective. And so showing that to the patient, seeing truly is believing, right? We'd have them put it on, try it on. Look what happens when you take a picture of yourself. You don't want these beautiful selfies you're trying to take of yourself having all this glare all over your face. So we're a vain species, right? So that was typically the winner of that conversation and trying to get them to have anti-reflective. But something else that I really appreciated was our dispensing mats. So our patients are sitting in front of us. We're having those conversations about frames or whatever. But then they look down, they see these simulated nighttime glare type images. And inevitably, we always had someone go, oh my gosh, that's exactly how I see. It drives me crazy. And in that, we can go, hey, guess what? We have a product that will solve that problem. And it has a really cool name, Crizal. So Crizal has all of those beautiful benefits that truly help someone see better, look better, feel better. It really improves their quality of life. But what's great about the Crizal suite is that backside UV protection is on all of it. That's not an upcharge. That's not something that you have to worry about with the patient. It's there. It's one of those special features that you can count on, that you know not only is their vision going to be clearer and crisper after they leave your office, but they're also going to be protected for the life of their eyes. So that's definitely something that I appreciated. Also on the full suite is the Crizal Preventia. So, we talked about blue light and the damaging effects of blue light or the potential of it. And so it was really great to have that in my back pocket as well, knowing that that can also solve a lot of issues and concerns with the protection level. So something else I want to point out though, Pete, is definitely the fact that the level of public awareness and the ocular hazards of UV is dangerously low. And a few eye care professionals incorporate UV protection into their daily patient routines, but some don't. Sometimes the time does not allow them to do that. Consumers are aware of how sunscreen products work, right? How we're able to protect our skin from the damaging UV rays. However, unless you are wearing your lenses, there's really no way to protect our eyes from all of those horrible things that Dr. Loff expressed with us. So something to think about and something to be proud of is that Crizal has got something to meet that need, to help our patients have that exceptional vision and also have that protection for the life of their eyes. So something else that really helped me in the moment of sale, if you will, not only the fact that they're going to look better and feel better, but also now the conversation is more simple because Crizal non-glare lenses have actually earned the Skin Cancer Foundation Seal of Recommendation for their safe and effective protection against UV light. The seal of recommendation is recognized and trusted worldwide. It is overseen by renowned experts and dermatologists and granted products that meet the foundation's stringent criteria for safe and effective sun protection. So that's just that extra something that helps us with that conversation as well. But also during the eye exam, as you know, Pete, patients are presented with this environment that gives them optimal vision and clarity. And within this environment, the patient's visual acuities are tested, and with a little flick and a click, they see perfect, right? But when the patient is set to 20/20 or better, our opticians are only as skilled as the tools we've been given. So it's so important that we sit down and have that explanation of, yes, Dr. Parker was able to give you perfect vision in the examination room, but let me tell you how you can have that crisp, clear vision that the 4-opter lenses have treatment on that can really help you see better even after you leave the practice. So definitely, it's an exciting conversation to have with the patients, to let them know, hey, we've got something awesome to share with you, but also help them know that we're going to help improve their quality of life and help them see better in the process.
Yeah, as an optician myself, I can totally attest to what you said about teamwork. If there's been a good conversation in the exam room, the discussion I have in the dispensary is much easier. And, you know, just as you highlighted, the Skin Cancer Foundation has given a seal of approval to Crizal no glare lenses. It's the only no glare on the market that's been given that seal, and there's a good reason for it. Dr. Parker mentioned earlier that typically no glare lenses are going to reflect quite a bit of UV. And just in case we aren't all experts on no glare, one of the reasons for that is because no glare works on the principle of destructive interference. That means it actually cancels out reflections by creating other reflections. Now, in the visible spectrum, you get rid of those reflections, so they're invisible. But what most people don't realize is that UV light is shorter in wavelength than visible light. And so what happens is all those extra layers in the no glare coating, instead of canceling out the UV, they're actually multiplying the amount of UV that's getting reflected back into the eye. And so if you're going to use a no glare coating, which you really should, only 40% of Americans who wear prescription lenses have no glare on their lenses. I know everyone says they sell 100% no glare, but somewhere in there, over half of Americans aren't getting it. And if you are going to sell a no glare, you want to make sure that it's not amplifying the amount of reflections that come off of those lenses. Now, I'm going to put the doctors here on the spot. What would you say, and I know that this is review for every optometrist and ophthalmologist that's out there, but just to remind us, and the reason I bring this up is a few years ago, we had a discussion panel much like this on UV with a number of doctors, and one of them was a dermatologist. And halfway through the discussion panel, the dermatologist said, it never occurred to me that ultraviolet light would damage the eye. Now, this is a doctor that talks about ultraviolet light all the time. So if a dermatologist doesn't know that, for sure, as you said, our patients are not aware of this. So for the doctors out there, could you give me the top 5 damaging things that are going to happen to the eye itself whenever you get exposure to ultraviolet light? Because I think for a lot of opticians out there, it might be helpful, and it might be a good reminder and a review.
You're educating, you're not selling. And I know a lot of doctors feel uncomfortable selling, but you're really educating the patients, and you're doing it as part of a teamwork process. That's how it works best, right? Some of the things that you want to watch out though for UV, and so many doctors are so conscientious about that now, with UVA and UVA being more inflammatory and UVB meaning more burning sensations to the eye and adnexa. But the thing is, the macula, the retina, many doctors are very vigilant about ordering, particularly if the patient has a family history of macular degeneration, they're ordering genetic tests. They're doing a lot of things, prescribing nutraceuticals, discussing the proper diet, lutein, zeaxanthin, and all the things that you need to get your green leafy vegetables into your diet as a means of protecting the macula. So that's one thing. You've got your pterygium, you know, the growth that overgrows over the cornea, where you see in certain areas of the country, you'll see it much more prevalent. But it is a situation that is precipitated by heavy UVB radiation. And so those are two things, and just photosensitivity and photoinflammation of the cornea, where the eyes just hurt and fatigue from the bombardment of UV protection. And that's something that some may not consider disease, but that and a disruption of your tear layer as is associated with that. So I point out these areas because these are things that we're, as doctors, addressing in the exam room, But if you're only prescribing prescriptions for those that are in the form of a pharmaceutical or a nutraceutical, and then you leave off the secondary component of that, which is the refractive tools that they need to protect their eyes, and to Pete's point, so that you're not getting that exponential amount of UV radiation that's coming off the back surface of the eye and in close proximity to the face and the eye orbital area, then you have only done half the job. It needs to be both tied together. And that's really where the patient gets the best experience and the best outcome.
Yeah, I was just going to chime in also. I think it's important to just distinguish and differentiate between UV exposure and blue light, obviously being different wavelengths. UV is the shorter wavelength, obviously an invisible part of the wavelengths that occurs right beneath the violet component, the wavelengths, and then you have the blue wavelengths, which typically are about 400 to 480, 500 nanometers. At any rate, the blue light can cause, or has been speculated, a lot of studies coming out now showing a lot of potential damage to the ocular structures, especially the retina. And younger patients, obviously, are, I hate to say it, sun worshipers. They really don't think that they're going to necessarily get skin cancers because it's not something that typically occurs as a direct result. It's typically a cumulative effect occurring at least 10 plus years after the exposure, and more importantly, occurs typically after patients get burning of the skin more so than just chronic UV exposure. So when a patient has a true sunburn, that significantly increases the risk of skin cancer versus just recurring chronic UV exposure. So most younger patients really, unless there's a strong family history or they just have a terrible skin type, especially redheads, freckles, they really don't give too much thought to UV exposure. However, nowadays with computer vision syndrome, all the exposure to digital types of equipment, smartphones, computers, TV, and even UV exposure coming from light sources, clearly there's significant increased exposure to the blue light, which can have damaging effects, different, but obviously overlapping the UV exposure. So I think it's important to, again, notate, distinguish between the two, but clearly important from the perspective of protecting the patient's eye with blue light blocking benefits, UV blocking benefits, things of that nature. Again, as it relates to blue light, it's felt that it causes damage to the retina, increases potential risk for macular degeneration later on in life, probably some associated risk with increase of cataracts, and again, as Dr. Knight had mentioned, pterygium and certain types of corneal disease. So it's important to try to educate the younger patients as to the benefits of a good lens with UV, with not only UV blocking, but also blue light blocking benefits, as Crizal does. So I think that's important. And then clearly with UV exposure, the increased risk of skin cancers, as Dr. Knight had mentioned, the UVB is the burning type. So clearly you want to try to decrease the UVB exposure. And again, with a lot of the reflection coming off the poster aspect of certain types of lenses, that can certainly exacerbate and increase the incidence. Again, as most eye doctors, even an oculoplastic surgeon, it's something that's not really readily taught to us. Typically, we're taught on the ophthalmology or oculoplastic side, they just need good eyeglasses with UV protection within the lenses, but you're not really distinguishing between anterior and posterior reflection of UV light. So I think that's very important to notate and educate eye doctors.
It's very interesting because both you and Dr. Knight mentioned that young people in particular don't think about cancer very often because as the parent of 2 millennial children, let me tell you, they're going to live forever.
Of course.
But I did notice, and I'll give Dr. Parker here a warning because I'm going to put you on the spot here. I have a 20-something-year-old son. We have lived in Florida and we've lived in Texas, so we see a lot of sunshine. And of course, when my son's emmetropic, so he doesn't wear a prescription, but when I got him sunglasses, I got him very high-end, expensive sunglasses that we sell out of our optical. And when he would go out on our jet ski here in Texas, he'd be out all day wearing his very expensive sunglasses. And then around 8 or 9 o'clock at night, he would complain about wanting eye drops. And I'd be like, why do you need eye drops, Pierce? And he would say, well, my eyes feel very scratchy. Now, I'm just an optician, but I'm thinking, well, that sounds a lot like whenever I was in Florida, we used to have students that would get superficial punctate keratitis. I believe that's the one, after exposure to UV. So, but he's wearing sunglasses. So one day we had a UV meter that could measure reflections off of lenses. And I took these expensive sunglasses in, and I was shocked to find that they were reflecting 60% of ultraviolet light off. It was like a mirror coating on the back of the lens for UV. So I switched them out to Xperia UV lenses, which reflect about 2% of UV light, and he can spend all day. Now, Dr. Parker, first of all, am I correct that SPK may be causing, even though you might not get snow blindness, it probably explains a lot of people that feel that they have scratchy eyes at the end of the day? And is there any danger to getting mild cases of SPK repeatedly?
So it's funny, I was going to put you on the spot as well. So this is only fair, because I know you thought you're just going to have to moderate and you bring your A game and you ask us questions. So I was going to tee you up and put you on the spot and ask you about, how does non-glare reflect other non-glare reflect 50% more, but you took it out of my mouth and you did an eloquent job like you always do that. But to answer your question, so it's very interesting. When you have minor SPK on the cornea, the weird thing is patients don't necessarily understand what's going on. They're weird symptoms, and it could be like tired eyes, fatigued eyes, and you think you're doing your job by wearing your sunglasses. But just like you said, some sunglasses actually make a bad situation even worse, because they do a great job protecting on the front, but the sun's behind us a lot of the time. So that sun hits the back of the lens. I mean, what shape does the lens look like? It's right here. So that shape focuses that ultraviolet radiation back to the cornea. And any time that you get any staining on the cornea, which is going to happen in SPK, you break that barrier and you do have a chance that stuff can start going awry. Now, if it gets really bad, that's where eye infection, you can get bacterial and viral infections, because that barrier prevents bacteria and viruses from getting into the cornea. So once you break that down, you've opened up for infections. But as Dr. Knight talked about earlier, one of the things that I think we're going to see some amazing research come out of is the fact that ultraviolet radiation can probably damage some things in the tear film that can lead to surface dryness. And so that's why it's really important to have an awesome pair of sunglasses with the right technology in them. And the way that I would tee this up with my customers and my patients is the fact that they understand ultraviolet radiation when it comes to the skin. They know UV is bad for their skin. And how many mothers would send their young kid outside without sunscreen on? And this is an easy conversation to tee up. Ask, hey, so what do you do for ultraviolet protection for your skin? Ask this to mom, and they'll go in and talk about this. And then you just say, what are you doing to protect your child's eyes? And it's crickets. It gets very, very quiet. And that's where you can start talking about all these things that ultraviolet radiation can do and how we can protect, and how Dr. Loft eloquently said, you get the exposure now, but you don't see the damage until down the road. So it's early and often protection that I think is important. So I know that's kind of a roundabout answer, Pete. I hope I answered your question in a nutshell. Yes, anytime you get any surface breakup with the cornea, it can lead to things that are even worse.
You answered the question perfectly as usual. And also you brought up an interesting thing that is sometimes misunderstood, because if you look at Crizal literature, you might notice that it has something called an ESPF rating. And you had mentioned that no mother would send their child, they slather them with, SPF 35 all over their body, but then they send them out there with no hat and no sunglasses. And of course, their eyes and the skin around their eyes, because what kid is going to let you put SPF 35 sunblock around their eyes? Not my kids. You might notice that Crizal products have an ESPF rating. So what exactly does that mean? Let me go with the highest one, ESPF of 50, which if you had a sunscreen block of 50, well, you're covered. Well, that's what you find on Xperia UV lenses, which have Crizal technology on the back. The reason for the 50 rating is this. Of course, the front of the lens is going to block all of the UV light that's striking the interior surface of the lens, but it also is only going to reflect 2% of the UV that strikes the back of the lens. So what that means is you've reduced UV exposure 98% compared to if you didn't wear glasses at all. And that's where they come up with the ESPF 50 rating. You might be asking, well, okay, if I put regular dress glass lenses on people with regular AR, typically they're going to be an ESPF of 3 to 6. So protect your eyes. Does anyone else have anything else that they'd like to chime in that they might have thought of while we were having this discussion over the last few minutes?
The one other thing I would comment, Pete and Dr. Parker, is with respect to not only the UV exposure with obviously different types of glasses and or sunglasses that increase the reflection internally from the posterior surface, causing a lot more exposure to the ocular surface. In addition to it potentially causing keratopathy SPK, obviously repeated exposure can not only increase the incidence of pterygium, but also squamous cell carcinoma of the conjunctiva. So we see that as fortunately not very common, but again, just like the skin of the eyelid skin, the skin of the eye, the conjunctival surface can have increased UV exposure that can lead to the increased risk of squamous cell carcinoma of the conjunctival surface.
So if I might add, you guys have been talking about the front surface, and I want to move a little bit further inside and talk a little bit about, that pristine lens after cataract surgery. I know Pete has a lot of thoughts about this, but once the surgeon removes the cataract lens, which in many ways is actually acting as a protective barrier for the free radical damage to the retinal tissue itself, but once that's removed and you put a nice, pristine, clear lens back in place, of course, the patient sees great now and everything's clear and maybe their color vision's back and all of those things. But now that protective barrier is gone. And so it becomes even more important to make sure that you're prescribing a spectacle lens that protects that patient from that extra UV damage that now has a clear entry point and a clear route to get back and cause damage to the retinal tissue. So just another thing to keep in mind when we're, again, addressing the patient's needs in the chair, that we have to make sure that we pass that baton to our optician so that and that they know why you're prescribing that particular type of spectacle lens and solution. So Crizal is the answer for that.
Yeah, and I won't go off on the rant that I would usually go off on, but I will suffice it at this. If you look very hard, if you're an optometrist and you co-manage cataract surgery, do some research into the types of IOLs that are placed in the patient's eyes, because in over half of all cataract surgeries, 3.6 million of them a year in the United States, in over half of them, the lens that gets inserted in the eye is clearer than the one that the patient was born with. And I know that we're talking about UV today, but when it comes to blue light, those lenses are allowing a lot more blue light through that lens than the 55 to 65-year-old natural lens was allowing. And so it's almost a standard of care that if your patient has had cataract surgery, they need to be wearing dark lenses when they go outside. And to Brooke's point earlier, if you simply tell the patient, you've had cataract surgery, you need to wear dark lenses when you're outside because some of the natural protection has been removed, it makes our job so much easier at the dispensing table to sell either a polarized lens or a photochromic lens. So any other thoughts here?
I wanted to just reiterate what you, Pete, said, as well as you, Dr. Knight, and really that it's a team effort. And just some of the things that you could maybe take away and bring back to your practice and have conversations with the staff members on how they can contribute to that conversation is from the moment you pick up the phone to make an appointment. Ask the patient to bring every one of their pair of glasses that they own to the examination. During that time, it'll tell you a lot. Not only will the patient say, oh, I only have one pair, well, that's a place for you to put a note in their chart, hey, they've only got one pair. all the way into the examination room when you're looking and looking at the prescription of the glasses that has been given. You can say, hey, this one doesn't have any anti-glare on that, you know, and start that conversation about the benefits of it. But also in the history, taking down the history of the patient and the family history, really having that conversation of, hey, it looks like your mother had macular degeneration, or looks like your father had early developmental cataracts. Let me tell you how you can prevent some of those potential DNA situations from happening to you a lot faster than what we hoped. So again, that message can travel from person to person throughout the entire journey. And when it comes to the optician, our jobs are all that much more easy. And even the patient will tell us, yeah, the doctor told me I needed this. The technician told me I should have this. And so already in their mind, it's become very clear what is going to be the best option for them. It's not all on the shoulders of the optician.
My kind of parting shot, if you will, where we all know that non-glare gives us amazing vision. That's why almost 10 out of 10 eye care professionals have it. 4 out of 10 of the consumers have it. So hopefully we've given you some information today, a litany of information on reasons why you can make the optician's job easier by giving them a reason to wear non-glare. Because if they do that, they're going to have better visual experience, which they're going to perceive us as better doctors. And remember, Crizal separates itself from the competition because it's the only one out there that does an amazing job of protection in addition to awesome vision.
I can say that the one doctor that I worked with who had almost 100% of his patients would buy no glare. He had one very easy conversation in the exam room. While he was flipping lenses, he would simply say, did you ever notice that you see better in this room than you do in real life, especially when you're driving at night? Because no one who wears glasses for night driving who doesn't have no glare, they don't like it. And when the patient would say, yeah, my glasses are awful for driving night, and he only mentioned this to people that didn't have no glare, but he'd say, yeah, that's because the conditions in this room are perfect, but the conditions in your real life are not perfect. Ask the optician about no glare, because I can make you see at nighttime when you're driving just as good as you do in this room. His patients would walk into the dispensary and say, hey, I need something to help me see better when I drive at night. What is that no glare stuff? And they didn't ask if it was covered by insurance or how much it cost. The doctor had mentioned a solution to a problem and they wanted it. So thank you so much, y'all. This has been a tremendous panel discussion. And we're going to take some questions and answers coming up here. But for now, I'm going to wish you a great Sunday and enjoy the rest of your conference.
Good morning. Thank you for attending our panel discussion here at Eyes On 2021. We're very excited to see everybody here today. Some really interesting discussion from the group around Crizal and the UV protection of the Skin Cancer Foundation. As a thank you for those of you that have attended the session, we encourage you to email crizal@essilorusa.com. That's at essilorusa.com to get a free merchandising kit for Crizal to help you in making that recommendation to the patient. That's going to include a great sign about Crizal No Glare for your dispensing table, some clings for the wall, and a beautiful exam room poster that's going to look even better in your practice than it does here in my dining room. So with that, I want to open it up to a few questions that we've received. First, Dr. Loff, I hope you're doing well this morning. What I'd really want to ask you about is, from an ophthalmology perspective, how do you have that discussion with your colleagues about recommending Crizal, especially for post-op cataract patients? And how do you tailor that discussion to them based on whether or not they're actually dispensing eyewear at their location or they're not?
Thank you, Jeff. So very good question, I must say. At any rate, from my perspective, again, as both an ophthalmologist and oculoplastic surgeon, I think it's incredibly important for patients that do wear glasses to obviously have the best and most optimal protection for their eyes as well as eyelids. So we obviously know that Crizal offers the best UV blocking protection, as well as, which is incredibly important, a lot of the UV exposure actually is is a result of the glare and reflection off the poster aspect of the spectacle lens, that it's very important with Crizal's technology to minimize that reflection exposure. So as a result of that, I think it's a very easy conversation to have with colleagues and patients to certainly go ahead and let them know that if patients do require lenses, obviously it's best to give them the best protection to minimize the UV exposure and therefore potential sequelae as a result of the UV and blue light exposure. So being that Crizal offers the best protection from that perspective for patients that are post-op cataract surgery, maybe post-op eyelid surgery for skin cancers, or even those patients that have very light skin, burn easy, family history, any predisposing risk factors for skin cancer, or for that matter, macular degeneration. And we all know, obviously, post-op patients, after they have their lens removed, the lens obviously filters out a fair amount of UV and blue light. And now with a clear lens as a intraocular lens replacement, it's even that much more paramount that the patient has that optimal protection.
Well, great. And Dr. Parker, when you think about from an optometry's perspective, there's a number of ophthalmology practices that are going to do the exam, have a conversation with the patient, but then not really have a place for them to get the eyewear. How should local optometrists partner with ophthalmologists in their area to build those bridges to get a firm recommendation from the exam, from the eye exam, to somewhere where they can get the quality eyewear that an independent optometrist is going to provide?
Yeah, Jeff, as we've been friends for a while, I practiced Southern Oklahoma for a while. So this is a great question you threw my way because I had to do it on a regular basis. The ophthalmologist that I worked with in Ardmore, a gifted surgeon, amazing man, didn't have an optical. So the way that we found it works is we just had two-way communication. I mean, I didn't know all the new advances that were coming out in IOLs and what type of lenses he was putting in. Did it block UV? Did it block blue light? What were the multifocal IOLs? But he didn't know anything really about the advancements in spectacle lens technology either. So we met on a regular basis and simply exchanged information. It could have been over lunch, it was over dinner, and it really helped us care for our patients in a much more comprehensive manner. And so things just like this, when they would come out and say, hey, this is what Crizal has now, it's more than just blocking light, it's about ocular health, then he would talk to the patients about that when they would come back and see me. But for me, I would also tee him up saying, hey, Dr. Sherry, he's got X, Y, and Z now available, and you need to have that conversation. So just help the conversation on both ends, Jeff.
No, that's great. No, I think it's really important to have that. The patient needs to be hearing the same thing regardless who they're talking to. As it relates to that, Brooke, when you think about when the patient makes it into the dispensary, gets in front of you, starts talking about the options that they have, how have you handled those times when a patient doesn't really understand what a no glare lens is? How do you help them get over the hump of, no, this is what you have, all these benefits? What has been your message to patients to get them into a Crizal no glare lens or any other type of anti-reflective?
Definitely, Jeff. So typically when we have a patient come in, the best option is to start to ask them open-ended questions and really start to help understanding, what they're experiencing every day. What do they do for a living? What do they appreciate doing as a hobby, or what do they do outside? And so typically in that conversation, we start uncovering some issues. And in that conversation, of course, non-glare, that's always something that people understand, but also the durability aspect, cleanability, the ability to let water run off of it. But also the UV is typically like last thought, and that shouldn't be the case, right? We should definitely be discussing the fact that, yes, these are pains that we're experiencing, and we do have a solution for it, but we also want to make sure that, we care about you, and we want to make sure the life of your eyes are taken care of for the longevity. And of course, when you talk to someone, I really wanted to reiterate what Pete said, because it's true. Most of us are not staring at the sun, right? But we are definitely keeping our backs to the sun. And so what's happening with that is the sun is actually bouncing off the back of the lens and right back into the eye, which is it could be dangerous and definitely potentially harmful to your health. So, just kind of going back to your question, the best way is to definitely have conversations, meaningful conversations, and open-ended questions to try to uncover some of the needs that they're experiencing, or they may not even be realizing they're struggling through. And typically Crizal non-glare typically fits the bill for all of those concerns that they have.
No, that's great. Thank you for that, Brooke. Dr. Knight, what would you say to a colleague that comes to you and say, you know what, I get it, UVA, UVB is bad, obviously, but that's why I have 100% polycarbonate, 100% high index lenses. I don't sell anything less than that. So what do you tell them to make sure they understand that it's not just the material?
So I thank you for that question. First of all, I would remind them that we're only doing half the work if we're only doing the medical portion of the exam and the refractive portion of the exam. You really have to tie the two together, and in order for the patient to really get the best experience overall, and giving them an opportunity to be educated on what's available and what's available based on their individual needs is critical, particularly if you have a patient, to Dr. Law's point, and Dr. Parker's, if you've got a patient that's post-operative, or you have a patient who is prone to skin cancers, patient that has issues with macular degeneration, or any other chronic inflammatory condition that could be made worse by increasing amounts of UV or harmful blue light getting into the eyes. Providing that back surface UV protection is really, really important. So important. That's why I think we said this earlier, but I think we can say it again, that the Skin Cancer Foundation has given us a seal of recommendation for Crizal for safety and effective care for the eyes. And it's just really something that I think we should all take a moment to educate our patients on and make them aware that's important.
Great. That is great, Dr. Knight. I thank you, especially with the Skin Cancer Foundation. We've got a great question from a longtime friend of our group, Dr. Glover. His question is, and we'll throw this around to the team, how important is it to have this conversation before they even enter the office? If you think about when they're setting the appointment, and a follow-up question on more tools or like the Transitions virtual try-on. What kind of things can we put out there to start the conversation before the patient even walks in our door? Dr. Knight, since you finished, you want to kind of follow up with Dr. Glover's question about this conversation even before they get to the office?
Yeah, thank you, Dr. Glover. I would say that, first of all, one thing that COVID taught us is that it's really critical to communicate with the patients, communicate with them early and often, and the more of the exam that you can do before they come into the actual physical space, the better. It's safer for everyone, and it's an opportunity to really educate them and give them time to digest the information that you've given them. And once they come into the office, then you can reinforce it again through your staff. I was a 100-meter relay runner in college, and I was fast. But it didn't matter how fast I was. If I didn't pass a baton correctly and dropped it, we still lost the race. So it's really critical for everyone in the office, every stakeholder, everyone that touches that patient, to have the same type of conversation so that the patient is hearing it multiple times. And then it's not a sell. It's really a matter of educating them. That's critical.
Great. No, that's perfect, Dr. Knight. Remind me never to ask you to have a race out in the parking lot behind the office. So, all right. And with regards, Brooke, when you think about a demo tool, Dr. Glover's question about the Transitions virtual try-on, are you able to leverage those types of tools with the patient to, as Dr. Knight says, make sure they've got the full recommendation from the entire staff?
Yeah, definitely. So as I shared earlier, seeing is believing. We can talk all day long about, what we feel would be best, but once they actually try the product on and they see the amazing results from being able to see clearer, being able to clean the lenses better, but most importantly, as we discussed today, making sure that their eyes are protected from backside UV as well. Demos are something that I just cannot reiterate enough that really helps set us us up for Opticians for Success, but also helping the patients understand what we mean. The language we speak is kind of difficult, and being able to actually verbalize what your visual experience is, it's very difficult, even for us that are trained in the industry. But demos, highly recommend you have them in the office and have them handy when you're having those conversations.
Yep. No, that's great. And I think we can always leverage the tools like the transitions virtual try-on. As a lot of times it's meant to show the cosmetics and the appearance of the lens, but we can't forget that it's also about the protection as well. Before, I don't know that we have any more follow-up questions to that, but before we kind of start wrapping this thing up, there's been a really great discussion, a lot going on. I think if everyone could take a moment to say, what would you like your colleagues to do tomorrow? Granted, if they're not taking the week off for Thanksgiving, they took the time out on a Sunday to come to Eyes on 2021, hear the panel. They've absorbed it. What do you want them to do when that patient walks in the door tomorrow? Dr. Loff, if you wouldn't mind starting off, please.
Yeah, thank you very much, Jeff. So at any rate, from my perspective, again, thinking more from the point of view as an oculoplastic surgeon, skin cancers are incredibly common, becoming more frequent, unfortunately, in this day and age. And so a lot of people really don't appreciate the gravity of periocular eyelid skin cancers. Most are fortunately basal cell, which are slow growing and not incredibly aggressive and typically don't metastasize. But unfortunately, probably 5 to 10% can be much more aggressive, especially melanomas and certainly squamous cells. Melanoma, basal cell, and squamous cell obviously are all related to UV exposure, increasing the likelihood and propensity. So with a small percentage of eyelid cancers actually having significant morbidity or mortality, it behooves us as eye doctors to certainly do a thorough eye exam. Any suspicious lesions should certainly be addressed. But clearly in this day and age, I think preventative medicine is the best medicine. And certainly patients that are predisposed have a history. If y'all want to bore yourself, there's Fitzpatrick skin types that you might want to read about. But typically the Fitzpatrick 1 and 2 patients, which are the fairer skin, redhead, freckle, light colored eyes, light skin, those patients that typically pretty much either always burn or frequently burn and very difficult in tanning, those are the patients that are going to be most at risk. So I would certainly highly suggest those patients be given extra special consideration to the Crizal lens and optimize their periocular protection, UV exposure, and give them the best vision possible.
Great. Thank you, Dr. Loff. Dr. Parker?
Well, first off, to all of our colleagues out there, I hope you have a great, relaxing week. Hopefully you get some time off to safely spend with your friends and family. I would leave you with this. It's low-hanging fruit. Most people on this call, I would say 9 out of 10, 9 plus out of 10 have non-glare on their lenses. 4 out of 10 of our patients are walking around with it on. We've got to do a better job. We know the value as optical experts. We have to use our words in the right way to make sure our customers and our patients understand the value. And the Crizal seal of recommendation helps tremendously with that. So it's low-hanging fruit. We know they're going to see better. And now we can talk to them about not only seeing better, but protecting themselves from ultraviolet radiation.
Brooke, any thoughts for the opticians in the audience?
Yeah, definitely. It is low-hanging fruit, guys. It absolutely is. But be thinking about our patients have this on their minds. They have protection. They are having these concerns and these issues, but they may not realize that there's a product out there that can meet their needs. But in addition to that, be thinking about we want to grow our market. We want to grow our business. This is a differentiator, guys. This could set you apart from your competition. You have something amazing in your toolkit. Definitely use it. I promise you, once the patients have it, they'll never want to go back. There is a 95% satisfaction rate with Crizal wearers. So use that to your advantage to set you apart from your competition.
Thank you, Brooke. And Dr. Knight, the last word, please.
My key is always on protection. patients should always have their Crizal lenses on, because it's not just the sunshiny days, it's the cloudy days. It's all days. So if you always have your protection on, you never have to worry. And when your patient comes into the examination room, my other recommendation would be to educate them every step of the way. Patients don't know the value you bring. They don't know what you're doing at each part of the examination unless you tell them. And it's a great opportunity to do that and to continue that conversation from pre-exam room to your examination room, back out to the optical, and make sure that the entire team is effectively working together, because optometry is a gateway into the medical system. And we can see things before many other practitioners can, and we should take advantage of that. But again, the most important thing is that always on protection.
Thank you. Just to wrap up, while we were having those great answers on the question, we did have one other thing come in from the audience around the kind of pieces and tools that Essilor will provide in 2021. I can take this one and assure the audience that coming in 2021, we will continue to partner with eye care professionals on tools, training, and education. Because to me, it all starts with education, educating the staff, educating the whole team so they can educate the patient. And we'll do our part to help educate that patient as well, send them to the right place for that comprehensive eye exam and the best eyewear they can get, regardless of whatever they need, whether it's Crizal, Transitions, Verilux, and new and messaging and education on blue light, because we know that's on everyone's mind as well. But with that, I'd like to thank the panel, thank the audience. Enjoy the last days of Eyes on 2021. We appreciate you attending this new and innovative event in these times, but it's a great way to continue to get the message out, and education is always at the forefront of what we want to do. So with that, thank you and have a great rest of your day.
Thank you, everyone.